Valproate is a medication that has been widely prescribed for various neurological and psychiatric conditions. From managing epilepsy to bipolar disorder, it has proven to be effective in many cases. However, as with any medication, there are both benefits and risks associated with its use. Medical uses of valproate. Valproate is primarily used as an anticonvulsant, meaning it helps prevent seizures in individuals with epilepsy. It works by increasing the levels of a neurotransmitter called gamma-aminobutyric acid, GABA, in the brain, which helps to calm excessive electrical activity that can lead to seizures. In addition to epilepsy, valproate may also be prescribed for other seizure disorders, such as absence seizures and myoclonic seizures. Another common medical use of valproate is in the treatment of bipolar disorder. Bipolar disorder is a mental health condition characterized by extreme mood swings, ranging from manic episodes of elevated mood and energy to depressive episodes of sadness and low energy. Valproate can help stabilize these mood swings and prevent the occurrence of both mania and depression. Valproate has also shown promise in the treatment of migraines. Studies have suggested that it may help reduce the frequency and intensity of migraines in some individuals. However, it is important to note that valproate is not typically the first-line treatment for migraines and is usually reserved for individuals who have not responded well to other medications or therapies. Common side effects of valproate. Like any medication, valproate can have side effects. The most common side effects include nausea, vomiting, stomach pain, and loss of appetite. These side effects are usually mild and temporary, often improving as the body adjusts to the medication. Taking valproate with food or dividing the daily dose into smaller, more frequent doses can help reduce these gastrointestinal side effects. Another common side effect of valproate is drowsiness or dizziness. This can make it difficult to concentrate or perform tasks that require alertness. It is important to avoid driving or operating heavy machinery until you know how valproate affects you. If these side effects persist or become bothersome, it is advisable to consult your healthcare provider. Some individuals may also experience hair loss or changes in hair texture while taking valproate. While this side effect can be distressing, it is usually not permanent and hair growth typically resumes once the medication is discontinued. If hair loss becomes a significant concern, discussing potential alternative treatments with your healthcare provider may be beneficial. Rare but serious side effects of valproate. While rare, valproate can cause serious side effects that require immediate medical attention. One such side effect is liver damage. Signs of liver damage may include yellowing of the skin or eyes, dark urine, persistent nausea or vomiting, or abdominal pain. Regular liver function tests are typically recommended while taking valproate to monitor for any signs of liver damage. Another serious potential side effect of valproate is pancreatitis, which is inflammation of the pancreas. Symptoms of pancreatitis may include severe stomach pain, nausea, vomiting, and fever. If you experience these symptoms, it is important to seek medical attention right away, as pancreatitis can be a life-threatening condition. In rare cases, valproate has been associated with an increased risk of suicidal thoughts or behaviors, particularly in individuals with a history of depression or bipolar disorder. It is important to be vigilant for any changes in mood or behavior while taking valproate and to seek immediate medical attention if you or someone you know is experiencing thoughts of self-harm or suicide. Risk factors and considerations for using valproate. There are certain risk factors and considerations that should be taken into account when using valproate. For example, valproate is not recommended for use during pregnancy, as it has been associated with an increased risk of birth defects, particularly neural tube defects. Women of childbearing age who are taking valproate should use effective contraception to prevent pregnancy. If pregnancy is desired, alternative medications should be considered in consultation with a healthcare provider. Valproate may also interact with other medications, including hormonal contraceptives, antidepressants, and antipsychotics. It is important to inform your healthcare provider about all medications you are taking to avoid potential interactions. Additionally, alcohol should be avoided while taking valproate, as it can increase the risk of liver damage. Alternatives to valproate. In some cases, individuals may not be able to tolerate valproate or may not experience the desired therapeutic effects. In such situations, alternative medications may be considered. For epilepsy, other anticonvulsant medications, such as lamotrigine or carbamazepine, may be options worth exploring. Similarly, for bipolar disorder, mood stabilizers like lithium or antipsychotic medications may be prescribed. It is important to discuss alternative treatment options with your healthcare provider to determine the most suitable course of action. Important safety information and precautions. When taking valproate, it is essential to follow the prescribed dosage and frequency. Abruptly stopping valproate or changing the dosage without medical supervision can increase the risk of seizures or other complications. Regular monitoring of blood levels may also be necessary to ensure the medication is within the therapeutic range. Valproate can sometimes cause a decrease in platelet count, which can affect blood clotting. It is important to notify your healthcare provider if you experience unusual bleeding or bruising. Routine blood tests may be recommended to monitor platelet levels. Monitoring and managing valproate side effects. Regular monitoring of liver function is crucial while taking valproate. Liver function tests, including blood tests to measure liver enzyme levels, should be performed at regular intervals to detect any signs of liver damage early on. Individuals with pre-existing liver conditions may require more frequent monitoring. To manage the side effects of valproate, certain lifestyle modifications may be helpful. For example, eating smaller, more frequent meals can help reduce gastrointestinal side effects. Maintaining a balanced diet and engaging in regular physical activity can also contribute to overall well-being. Legal implications and lawsuits related to valproate. In recent years, valproate has faced legal implications and lawsuits due to its association with birth defects. Several studies have highlighted the increased risk of neural tube defects and other congenital abnormalities when valproate is used during pregnancy. Lawsuits have been filed by individuals who believe they were not adequately warned about these risks. It is important for individuals who have been affected to consult legal counsel to understand their rights and options. Exploring alternative medications. Lamotrigine, Lamictal. Lamotrigine is an anticonvulsant that can be used as an alternative to valproate in the treatment of epilepsy and bipolar disorder. It works by modulating sodium channels in the brain to control abnormal electrical activity. Carbamazepine, Tegretol. Carbamazepine is another anticonvulsant that can be effective in treating epilepsy and bipolar disorder. It works by stabilizing sodium channels and reducing neural excitability. Topiramate, Topamax. Topiramate is used for epilepsy and migraine prevention. It affects multiple neurotransmitter systems and can help manage seizures and migraines. Lithium. Lithium is a mood stabilizer commonly used in the treatment of bipolar disorder. While its mechanism differs from valproate, it can help stabilize mood and prevent manic episodes. Conclusion. Weighing the benefits and risks of valproate. Valproate can be a valuable medication for individuals with epilepsy, bipolar disorder, and migraines. Its ability to stabilize mood swings and prevent seizures has improved the quality of life for many people. However, it is crucial to be aware of the potential side effects and risks associated with valproate. By understanding the benefits and risks, individuals can make informed decisions about their health and work closely with their healthcare providers to monitor and manage any potential side effects. Regular monitoring of liver function and platelet count, along with open communication with healthcare professionals, can help ensure the safe and effective use of valproate. While valproate may not be suitable for everyone, alternative treatment options are available and should be considered if necessary. It is important to weigh the benefits and risks of valproate in consultation with a healthcare provider to determine the most appropriate course of treatment for each individual. Thanks for watching.